I am Dr. Balram, Airan. I am the professor and head of the Department of Cardio-Thoracic and Vascular Surgery. In addition, I am the chief of the Cardio-Thoracic Center and Dean AIIMS. I have passed my MBBS from AIIMS, 1970 batch. So I have spent almost 45 years in the institute. The Cardio-Thoracic Center was established in 1986, and basic concept was to have all the disciplines related to the cardiothoracic and vascular sciences under one roof. So therefore it has got 8 departments that includes cardiothoracic and vascular surgery, cardiac radiology, cardiology, cardiac anesthesia, cardiac nuclear medicine, cardiac pathology, cardiac biochemistry, stem cell facility, and the organ retrieval and banking organization. In the Cardio-Thoracic Center, this is a 7-storied building which houses all these complexes, and we have got separate stem cell and orbo facility. In the OPD in the cardiac clinic, which is held on Monday, Wednesday and Fridays in the afternoon, we see more than 1 lakh patients per year. We have got 5 cardiac cath labs which are active every day, 8 operation theaters every day, which run from Monday to Saturday. On an average, we perform 16 elective surgeries per day plus emergency surgery. A total of more than 4,000 operations are performed per year. And most of these are the cardiac surgical operations, because we have got a list of cardiac surgery patients who are waiting for a long time, so we usually don't do much of the thoracic surgery. Our major vascular surgeries are taken care of. In cardiac cath lab, they perform more than 3,500 cardiac angios plus more than 2,000 interventions. As far as the rating of the facilities are concerned, this is one of the best in the world in terms of the quality as well as the quantity care. The surgical infections are low, patients go home. We perform the surgeries from newborns till the old age group also. That means that all types of the adult as well as the congenital cardiac operations are performed here. The new surgeries which are being performed are on the neonates, like arterial switch operation, which is going on for a long time. We have introduced the facilities of the ECMO support, that is the extracorporeal membrane oxygenation, left ventricular assist devices, which is a precursor to some of the patients who are waiting for the cardiac transplant. We were the first one to do the cardiac transplant at AIIMS in August 1994, and since then we are performing the largest number of the cardiac transplants in India in a public sector hospital. Also, we were the leaders in this venture. In the aortic surgery, we are leading India because we get many surgeries which are to be done in the emergencies, like aortic dissections, aortic aneurysm rupture, etc. And in this part, I like Dr. Sanjeev Sharma, who is the head of the Department of Cardiac Radiology, to talk about.
I am Dr. Sanjeev Sharma. I am the professor and head of the Department of Cardiac Radiology at the Cardio-Thoracic Sciences Center in All India Institute of Medical Sciences. This department was created in 1986 to provide state-of-the-art imaging and endovascular interventional facilities in cardiovascular diseases. The department today performs various forms of cardiovascular imaging in terms of doing state-of-the-art CT angiographies and technologies, MR imaging and MR angiographies, high-end duplex and Doppler ultrasound examinations, as well as various forms of angiographies and endovascular interventions involving various body systems in the human body. We are essentially plumbers plumbing the various blood vessels in the body. When there are blockages in the arterial or venous systems, we recanalize them and open them up. When these vessels start leaking, we embolize and stop the blood leaks. When they rupture or when they get enlarged, we do endovascular reconstruction and repair these vessels without cutting them open. There are also various new forms of endovascular interventions which we perform, which are cutting edge technologies. There are various cutting edge works which this department is engaged in, some of which include endovascular repairs of aortic aneurysms and dissections, research on the use of stem cell therapies for various vascular diseases such as critical limb ischemia, diabetes mellitus, among others. We also have a special interest and a key work in treating venous occlusions and various forms of venous diseases such as varicose veins, venous malformations, and deep venous thrombosis. Over and above these, we perform high-end imaging for various forms of cardiac diseases such as cardiomyopathies, ischemic heart diseases, congenital heart diseases, cardiac tumors, among others. This department performs work which ranks with the best in the world, and actually was the first department in Asia to perform various forms of endovascular procedures. For example, the first aneurysmal repair in Asia in 1994, first repair for the aortic dissection in 1998, first time for embolization of uterine fibroids in 1993, among others. We are also recently started a training program, a DM course in vascular and endovascular radiology, which the first batch will be starting in January 2016. The department is also trying to create teaching opportunities for training technologies, radiation technologies, for using these high-end equipments by creating an MSc and a post master certificate program.